Hi, I'm Roccario. I work with Albany Associates in Cardiology. I'm an Interventional Cardiologist. My dad was a doctor. Being with him, doing rounds with him, I just wanted to go into medicine, follow his footsteps, but mostly to do something worthwhile for society. We have a good core of doctors. We really have every aspect of cardiology that you need. TAVRs are our latest frontier of what we do in interventional cardiology. It's an amazing procedure. It takes about 20 minutes. It's just a little catheter in the common femoral artery, and it's usually conscious sedation. People don't need heart-lung machines anymore. They don't have to be intubated, and they're home within 24 hours. I just want to become very close to my patients and to be able to listen to them and to work as a team and not force a procedure upon them, a test upon them, try to explain things to them properly so that they can make, we can make decisions together and not just me telling them, this is what you have to do, this is what medication you have to take. It's a lot of teaching, it's a lot of listening, and just working together with the patient. You can, give them medications and hope they feel better, but you get dramatic changes when you're able to fix something and improve their quality of life.